Presentation at this Wonca conference is about the role of new technologies in knowledge management for doctors. The world of healthcare is constantly producing new information. We don't have time to read so much information, even if we choose articles of the highest quality. If a physician wants to be up to date, he or she has to read a lot. Because general practice is an environment where doubts are always popping up. And we don't always have answers to them. In short, doctors handle great amounts of information. Managing it well is a necessity with work that is as important as ours, for a job as important as what we have. This is the Brèche de Roland, an impressive natural gap in the Aragonese Pyrenees in northern Spain. It measures 100 meters by 40. There are other less natural gaps, the ones that come with knowledge translation. Patients don't always benefit from the best known advances. I refer to very common treatments for highly prevalent diseases. For conditions where you have to know what is effective and what is not, and to apply it in our practices. This is where new technologies are appearing to help us, such as Web 2.0, which is changing the faces of medicine, as we'll see here. Web 2.0 helps you find information. Knowing how to search is another kind of knowledge, as explained by this great English writer. There are tools like this one that help us create personalized search engines. For instance, a search engine for reliable sources of information on drug treatments in Spain. Or tools that let you customize your internet browser to add your favorite search engine. Typing a keyword in the search box for Avandia, for example, starts a search on lots of pages at the same time. In seconds, you receive information from pre-selected reliable sources. This screenshot shows how this tool makes searching for information fast and easy during a consultation. Web 2.0 lets you filter the information. So it helps you select what could be of most interest to you automatically. It's not a case of infoxication or information overload, it's filter failure. There are many websites and applications that allow you to filter information. PubMed clinical queries, meta search engines, selected resource sites. But people can also filter. Create networks around the selected information. We use social and collaborative software like Conatia, where doctors can save the information that is of interest to us and classify it using simple labels. These are folksonomies, another resource feature of Web 2.0. Web 2.0 helps you receive information. One of the resources that has been most associated since the start with this new web is RSS, really simple syndication, a tool that lets you share the contents of a website through web feeds. Here is a graphic representation of this change this truly disruptive innovation has brought us. RSS feeds have totally changed the way we access internet. They are read through content aggregators such as NetVibes. Here are some of the RSS feeds I consult to stay up to date with the latest publications on proton pump inhibitors. I receive them directly from Embase, PubMed, Trip Database, clinical trials, and other bibliographic sources of interest. This is what a public content aggregator looks like, with RSS literature sources in grey. Here is an aggregator created last year to keep up to date on the latest news on the H1N1 flu virus. These resources come from a great many sites from around the world. Twitter, a genuine social revolution, can also help us to receive information, such as news filtered by other users or institutions. Here we have an image of a Twitter reader. Web 2.0 helps you store and classify information. With Zotero, for example, this is a free add-on for the Firefox browser. It's a very useful manager for bibliographic references, saving the references on the browser and syncs your information on all of your PCs and those of other users. Or Dropbox, which makes work between different users easier by means of automatic file sharing through internet cloud storage. For example, a document on dyspepsia is stored in a common file for any doctors who might be working on this subject on different PCs. Web 2.0 helps you share and publish information. Information on your professional profile through social network sites like LinkedIn, or your own presentations on SlideShare, or information you find interesting on Twitter, or on blogs. Or you can post your own audiovisual presentations on your own YouTube channel. And why not information on your practice or health center by means of a network like B-Valley, designed to facilitate benchmarking. Web 2.0 encourages collaborative work. It lets you organize and plan your common project by means of a shared calendar. You can also work with other common document formats, Word, Excel, PowerPoint, uploaded on internet. Share information through distribution lists, which have an added RSS newsfeed design adapted to Web 2.0, or work on a common website, the way Wikipedia works. Lastly, Web 2.0 can also teach us how to make better use of information. This study shows that skills for using web resources can be incorporated into and improve the daily practice of primary healthcare professionals. This has been a presentation of how Web 2.0 helps to improve doctors' medical knowledge management. Thank you all very much for your attention.